hyperemia of the pulp, clinic, diagnostic, differential diagnostic and treatment. The plan of lecture. First, caries of dentin of medium caries, and the second, hyperemia of the pulp or deep caries. First, about classification and exactly about definition of caries. Caries is a localized pathological process that occurs after the eruption of the tooth under the influence of microorganisms characterized by the demineralization of calcified tooth tissue and the disintegration of the organic matrix followed by cavity formation. There is classification of dental caries according to clinical topographical. First, the initial caries, second, superficial caries, third, medium caries, and the last one, deep caries. Another classification is according to World Health Organization or International Classification of Disease. All forms of caries are classified as a K02. K02 is dental caries, K02.0 caries limited to enamel or white spot lesion, initial caries, K02.1 caries of dentin, K02.2 caries of cementum, and K02.3 arrested dental caries. Caries of dentin or medium caries corresponds to the code K02.1 and its name caries or dentin according to International Classification of Disease, and according to clinical topographical classification it is medium caries. Histologically, there are two cones. First cone in enamel and the second cone in dentin. And the process spreads along the enamel-dentin border between enamel and dentin. According to Silverstone, there are several pathomorphological zones. First, zone of decay, second, microbial avant-garde zone, next, demineralization zone, fourth, sclerosed dentin, next, intermediate, and the last one, substitutive dentin. There are two types of course of dental caries. First type is chronic course of caries and the second is acute course of caries. During chronic course of caries there are complaints, maybe they are typical. In the tooth we can see white entrance opening. The cavity is filled with a small amount of dense pigmented dentin. Dentin is pigmented, dentin is dent, and there are small amount of dentin. During acute course of caries, complaints are not typical. There are no complaints. We can see narrow entrance hole. The cavity is filled with a large amount of light dentin. Dentin may be light, soft, and there are a large amount of it. Pathomorphologically, in the acute course of caries, there are no zone of sclerosis and no zone of substitutive dentin. Clinical manifestation of medium caries. We apply both basic methods of diagnostic and additional methods of diagnostic. Results of basic methods of diagnostic. As for complaints, there are several options. First, no complaints. Next, maybe pain from chemical, less often from temperature irritants due to hydrodynamic theory. And the third option of complaints is aesthetic defect. As for inspection, we can find discoloration of the affected area, presence of caries cavity, and localization of defect. During probing, we found painful on the enamel dentin border, and percussion is painless. Results of additional methods of diagnostic. During temperature test, it is painful and short-term. In X-ray picture, we can see K03 type of cavity, and electroodontal diagnostic gives us result of electricity from 2 till 10 microampere in frontal teeth and from 7 till 20 microampere in posterior teeth. Differential diagnosis of medium caries provide with 4 diseases. First, it is superficial caries. Difference between medium caries and superficial caries is cavity in enamel. During superficial caries, cavity localized in enamel. Second differential diagnosis is deep caries. During deep caries, there are more complaints. Probing also different. Probing will be painful all over the bottom during deep caries. In medium caries, probing is painful in enamel dentin border. Also, different electroodontal diagnosis parameters. They are higher during deep caries than during medium caries. And in X-ray picture, we can see K04 type of caries cavity in deep caries, and in medium caries there will be K3 type. The third disease is chronic periodontitis. During chronic periodontitis, electroodontal diagnosis will be more than 100 microampere, and also we can find different changes in periapical tissue in X-ray picture. In medium caries, only K3 defect in the hard tissue of teeth. No changes in periapical tissue. And the last one, wedge-shaped defect. And the main difference between wedge-shaped defect and medium caries is the shape of cavity. During wedge-shaped defect, it will be like a wedge. Treatment plan of medium caries. We have to treat medium caries using preparation and filling. First, anesthesia, different anesthesia depending on the teeth, depending on the jaw and teeth. Next, preparation of the caries cavity to a dense light bottom. Next, antiseptic treatment using different antiseptic. Next, drying. Next, if needs, insulating gaskets. If we use cement filling. This stage may be skipped if we use composites, light curing composites. if we fill cavity with light curing composites, insulating gaskets doesn't needs, and permanent seal depending on class. As for stages of preparation of the carrier's cavity, there are 5 stages according to Bigelman. First stage is disclosure of cavity. Second, preventative expansion, creating an external form. Third, necroectomy. Fourth, the formation of cavity. It should be stable, retentive form. And the last one is finishing of the edges of enamel. And depending on classes of caries cavity, we choose filling material. And as for selection of filling material, during first class we may use silicon phosphate cement, glass ionomer cement, amalgam, composites and compomers. During class 2, the same material plus silicon phosphate cement. Class number 3, silicate cement, glass ionomer, composites and compomers. Class number 4, composites, and class number 5 we choose glass ionomer cement, composites and compomers.